Excellent. Whenever you're ready, we can get started.
Now we're ready?
Yes.
Okay. Hi, everybody. First, I'd like to thank you for having us here today. As Ms. Lambert said, my name is Barbara Quigley. I am the community health nurse for the Manchester Health Department. And with me is Jeff Catlett. He's our chief sanitarian. And we're going to talk to you a little bit about public health and a little bit more about local public health, what's going on in your community around public health. We're going to do an introduction to public health. We're going to talk about the 3 Ps, or the 3 principles of public health, which is to prevent, promote, and protect. And then specifically, like I said, we're going to talk about Manchester Health Department and the sections of Manchester Health Department. And there's really kind of 3 sections. We all work in the same office, but there's 3 sort of sections that we focus on. One is community health, the other is environmental health, and the third one is emergency preparedness, public health emergency preparedness. So, what do you know about public health? What do you think public health is? Can anybody kind of give me a definition?
Doing like health procedures for like the people or like individuals, like not publicly but just publicly.
Okay. Anybody else? Okay.
What was your question again?
What is public health? Can you kind of give me an idea what you think public health might be?
I think public health is basically keeping everything sanitary, keeping anyone who getting any outbreaks or getting sick, or just keeping everyone healthy. Especially like when we have like so many outbreaks and so many sicknesses and illnesses going around in us. So it's just everyone keeping everybody protected.
Good. Anybody else? This is kind of a formal definition of public health, which is the art and science of dealing with the protection and improvement of community health by organized community effort and including preventive medicine and sanitary and social science. But the easy definition of it is, next slide, you can hit it again. The question is, what does medicine do and what does public health do? So medicine, you can hit it again, saves lives one at a time. In other words, when you're like in the medical profession, where you're a physician or a nurse working in a hospital, you may have several patients, but you're concentrating on each of them as individuals. When we do public health, we save millions at a time. And while I like to think that we save millions at a time, here in Manchester, when people ask me who are my patients, what I say to them is I have 60,000 patients, because that's the population of Manchester. And our job, Jeff's and mine, in different ways, is to protect the health of our community, your Manchester community. So there's 60,000 residents here that we protect. Can you just go to the next slide? Okay, the 3 Ps, or the 3 principles of public health, as I mentioned before, is prevent, protect, and promote. So prevent comes under the heading of things like preventing epidemics and the spread of disease. Can you think of any epidemics recently in the news?
Ebola.
Very good, Ebola and international. What about, have you heard about an epidemic that's on the net just in the United States recently? You guys are good. Yes, you're very good. There are 2 that we have looked at. We are very fortunate in the Manchester Health Department that we have not had any cases of those to deal with. But because there's something that could be a threat to our community, we are prepared to deal with them. And we'll go into that a little bit more. We prevent injuries. How do you think we prevent injuries? Any idea?
Making sure like sidewalks are safe and trees
Right.
are kind of
Certainly public health can have some input into the infrastructure of the town to make sure that things are safe. We have a trail system in Manchester, and we have worked with the rec department to come up with an app that if you put that app on your phone and you're walking on one of the trails and you get lost or something, you hit the app, it locates where you are, so when you call 911, they can tell the emergency people where to
Sorry, I just have never heard that before. That is just an amazing thing.
Yeah, there's recent trail guides out, and right in the trail guide is the way to get the app, which, because I'm not savvy like that, I don't know what that means, but
Yeah. It'll tell you where you are on the trail in case of an emergency, somebody could come find you.
That's great.
right, it locates you exactly where you are. I actually was reading in the paper today that somebody was lost up on Case Mountain, and I don't think they had the app because they were waiting for 911 to get there. The other thing for preventing injuries is one of the parts of my job is I do employee health. And there are what they call OSHA requirements. The Occupational Safety and Health Administration requires that we do certain things for certain types of workers to protect their health. So we do things like bloodborne pathogen training for certain employees because they might be exposed to blood or other bodily fluids. We do hearing protection testing and training for them, and we do respiratory testing and training for them. We protect against environmental hazards, and I'm going to have Jeff go into that a little bit more.
Yep. So what do you think about environmental hazards? What could that be?
Fire.
Do any of you live in an older home? Yeah. A hazard could be lead.
Oh, yeah, from the paint.
Yeah. When's the last time you have eaten out at a restaurant? Probably pretty recently. That's, yeah, that's public health right there. That's a potential environmental hazard as well. So they're just some of the things, and we'll talk about them later on in the presentation, what those can include.
We promote and encourage healthy behaviors, and we do that through awareness campaigns and health education. I'll go into that a little bit more. We respond to disasters and assist communities in recovery, and we're going to talk about that under the Public Health Emergency Management, and that can be a natural disaster or it could be some kind of terrorist attack with a biological agent, and we'll talk about that. And it ensures the quality and accessibility of health services. So if people call us and they need health service and they're having difficulty getting it, then we do help with locating services for them. Okay. So some of the big public health achievements in the last century were things like vaccinations. I'm sure you all know that you've gotten vaccinations that are required to be in school. Do you know what some of them are for? Chickenpox. I'm sorry? TB, there is not a vaccination for TB. There's testing for TB, but there is not a vaccination.
What was that?
HPV is a vaccination? Yeah? I'm sorry?
Oh, rabies? Not rabies. No, there's one like, don't you have to get it every 5 years? Tetanus.
Tetanus is every 10.
Oh.
And that now, when you get tetanus, that's actually a 3-part. It's tetanus, diphtheria, and pertussis. Pertussis is whooping cough. And there's been a little bit of a reemergence of that in the adult population, so they're now encouraging adults to get that, where before we only had to get the tetanus and diphtheria. So there's a variety, and there's more than that, but that's a variety of vaccinations that are now available. Safer and healthier food, as Jeff mentioned, control of infectious diseases. We'll go into that a little bit. Recognition of tobacco use as a health hazard and all the efforts that they've made to get people to stop smoking, and the labeling on the cigarette packs, trying to make it more difficult for people under the age of 18 to get cigarettes, and the fluoridation of drinking water, which is kind of a big one that happened in the last century. Okay?
Okay, so we're going to talk about a little bit the Manchester Health Department, some roles and responsibilities, and who are the key players within the health department. So at the top of the chain is the Director of Health. In town now it's Mary Ann Cherniak-Alexius. She's in charge of the whole entire health department. We fall under the umbrella of Health and Human Services. So Mary Roach Cronin is in charge of that department. So as Barbara said, we have a community health side, which includes our nurses. And Barbara will talk about what the nurses do. A component of the nurses is also public health education. We work really well together in conjunction. The environmental side can identify an issue, community side can come up with a solution, or vice versa. Environmental health, we have registered sanitarians, which is a credential you can get. It's a state license. And we have environmental health inspectors. And we'll talk about what the responsibility of the inspectors are, and throughout the various parts of the environmental health program. And like Barbara said, we have public health emergency preparedness. We have a coordinator and trainer in incident command. Anytime there's an emergency in town, whether it's public health emergencies, and we need to set up a clinic, our public health emergency preparedness coordinator is responsible for that.
So let's talk about community health in Manchester, specifically in Manchester. Talk about prevention. I was told that this is a 10th, 11th, and 12th grade class.
10th, 11th here right now.
10th, 11th, okay. So some of you may have seen me before when we've come and talked to you about sexually transmitted diseases. That was something that we worked with the schools to allow us to come in and do, to educate you about sexually transmitted diseases, and to do some testing here if you wanted that done. And the reason that we did that is because it's my responsibility to look at communicable diseases in the town. There is a list that's published every year by the State Department of Public Health that are required to be reported to the state and local health department. And one of the categories of diseases in there is sexually transmitted disease. The reason we did this is because we were quite concerned with the number of sexually transmitted disease in the 10 to 19-year-old group. So when we saw how high the numbers were, we came and we thought, let's see if we can't educate students about sexually transmitted diseases and bring those numbers down. And I'm happy to say we've been doing it for about 5 years, and we are starting to see a decrease in the number in that age group. So I very much appreciate that you listen to what you're being taught. TB case management and spread of contagious diseases. Again, TB is one of those infectious diseases that are required to be reported to the health department. Now, when I talked a little bit about public health before, I talked about having 60,000 patients. But in those 60,000, I may have an individual that I have to give individual attention to. If someone has TB disease, different than TB infection, TB disease is a contagious disease that is a threat to the public health. And we do occasionally get people with TB disease in the community, and requires that I or one of my other nurses go out to the person's home. They take several medications to treat that disease, and we go and visit them every day to make sure that they take those medications until they're done, to make sure that they are cured and they are no longer a threat to the health of the community. Yes.
So do you guys have to put on like suits and stuff? Or?
If we go in and I could spend the whole class talking about TB, but if we go in and they're highly contagious, and that's indicated by several tests that they do, then we do put masks on. And of course, we always wash our hands. Big thing is to wash our hands. Once they've been on medication for a while, usually the tests indicate that they're not contagious anymore, so we don't have to wear equipment when we go in. But the other thing that we can do, the health director has the power to, if for someone in her jurisdiction, to quarantine someone if they are a threat to the public health. And sometimes we've had, very, very rarely, I've been in the health department for over 25 years, and very, very rarely have we had a case where someone will not be compliant with the treatment, and therefore are contagious and a threat to the public health. And the health director has been able to go to court and confine them under guard until they take their medication and are compliant with their medication. We don't like to do that, but we have the health director does have the power to do that. Somebody talked about human exposure to rabies. Rabies is out there. We do not see it a whole lot, but we do get a lot of calls, not a lot, several calls, once the warm weather gets here, about bats being in homes. Either they have a hole somehow that the bat gets in, or they've left a window open, or whatever happens. And usually it's initially reported to the animal control officer. And then they contact us so that we can contact the individual and talk to them about why they should be prophylaxed, which means taking medication before you're sick to prevent rabies, if there is a significant exposure. We protect, Jeff mentioned lead poisoning. This is something that the environmental side and the public and the community health side work on together. There are regulations where any child who has a lead level of 5 or greater must be reported to the state and local health department, and we have a whole list of protocols that we follow depending on the level of the lead. And I could again spend a lot of time on that, and I won't do it, but we do that. And we also do education classes. We educate the individual families, and we educate the community.
So what don't you like about your job?
What?
So what don't you like about your job?
What don't I like about my job? Gee, not much. I'll tell you what I don't like. I don't like it when people panic over things that they might not need to, and that's something when I talk about TB disease and TB infection. A lot of times you see in the newspaper that a school is all up in arms because they have cases of TB. likely it's TB infection, which is not contagious and not a threat to the public health. So sometimes the media gets me a little upset. But there's really not much that I don't like about the job.
No, I mean, I love my job. One thing that we'll talk about later with restaurants and homeowners, getting compliance. People know that the right thing to do is a certain thing, but they refuse to do it. So the interaction with those people that know that they're supposed to be doing something, but just refuse. That's the most frustrating part.
Okay, can I just-
Yeah.
Do you get a lot of hypochondriacs in your life? Like what?
I wouldn't call them hypochondriacs. I would call them concerned about certain things that they think they might have been exposed to or were exposed to, and what that means to them. Okay, so I wouldn't really call them hypochondriacs. I think people hear certain diseases and they panic a little bit, and they call and ask us about that. Yeah.
Okay, so if you're working in the department, are you really let's say you're at home, are you really germophobic? Are you really cautious about how you do certain things?
Actually, I'm not. I mean, I'm a big fan of washing your hands. I think if you wash your hands a lot and appropriately, then you can prevent a lot of spread of disease. But I also sort of believe that a little bit of exposure to germs is a good thing because you build a little resistance. So I'm really not a germophobic. So that's a good question, though. I'm going to try to go through these quick because I'm glad you have so many questions. Flu vaccination clinics we do this every year. You probably have seen our advertisement around, and we certainly recommend that everybody get a flu shot every year. Cover Your Cough campaign and Clean Hands campaign. A couple of years ago, we went around the town, and in the town offices, you'll see signs that tell you to cover your cough during flu season and wash your hands appropriately. Promotion is some of the health education campaigns we do. Has anybody ever heard of 95210?
I know when I'm asleep.
Is it
9 hours of sleep.
Oh, how proud are we? Oh my gosh, that's great. Yep, this is something that we actually started here in the town of Manchester a couple of years ago. And we have been promoting it since. We'll have some pictures of some of the things that we've done with it, so I'll go over it a little bit more then. The Live Stronger Longer program for senior citizens is an exercise program that teaches them strength and flexibility, and fall prevention. The Healthy Heart Community and AED program. You see those signs around town? You'll see a sign, it's got like a heart on it, it says Heart Safe Community. That's done out of the health department, and we make sure that people are trained in CPR and that there are AEDs available in buildings. You have AEDs in this building, as a matter of fact, because of that. And breast cancer awareness is another thing that we've done on a yearly basis. Okay. Okay, so community health month. This is the other public health nurse in town. She's primarily responsible for the geriatric program in town and some health education coordination programs. We do blood pressure clinics. We do them for the senior citizens. We also do them for the town employees. There's the Heart Safe Community sign and the AED signs. Every building that has an AED on it is required to have an AED sign on the building so that we know that there's one there should, God forbid, an event happen. That is an AED, but the other thing that we do is that we do train people in CPR throughout the community, and once a year we have what we call mass training. So we probably have 75, 100 people come, and we have a variety of trainers there to make sure that we have enough people in the community trained in CPR. Health education, STDs is one of them. We are occasionally asked, Jeff and I, to come either to a health fair or to a class like this, talk either about public health or what we do. So we do that kind of thing. Another example of health education is the 95210, because we do education programs around that, and we have developed programs that we're now doing throughout the community to get people to sort of follow these health principles. Okay. The wreath ceremony is held every year during October for breast cancer awareness. We had a very strong advocate for breast cancer awareness in this town. Her name was Nancy Pilber. She is the person who lobbied with the legislators to have, you don't do a tax form, but they're asked for a $1 donation towards breast cancer, and what they do with that is they provide mammograms for low-income women and set them up with treatment if they need it. And certainly the 95210, we had a scarecrow on Main Street during the scarecrow thing in October, and if you have seen our mural at the top of East Center Main Street. Another couple of things that we have done is we've partnered with the FLASH program, which is out of the rec department. That's a 6th grade after-school program that does community service, health, and sports, I believe. And they helped us redo the trail guide mix guide so that people can go out and use our trails. They also worked on the app that is connected to that. We are now doing what we call a virtual grocery tour. We have dietitians that go out and speak to groups who come, and they actually filmed a grocery tour in ShopRite supermarket, and they show that, answer questions, prepare a healthy recipe for you. We are also doing what's called Fitness for Kids. It's a fitness program for kids by kids called Fitness in a Flash. Flash Kids are working on that now. So that's just a very few of the things that we've done with 95210. And if you remember, if it was there when you were in the elementary classes, we now have 95210 on the school menus. So once a month, the produce of the month is featured on the school menu, and on the back is information about the produce of the month.
What is 95210?
It's 9 hours of sleep, 5 fruits and vegetables a day, 2 hours or less of screen time, 1 hour of physical activity, and 0 sugary drinks. So it all came out of a community grant that we had gotten from the State Department of Public Health. And what we did is we were asked to address childhood obesity. And rather than go and just talk to people about eating and exercises, we decided to create a more complete health picture. So we found this, it's actually out of Virginia, and we adopted it for the community.
So what's the education that you need to get
To do what I do?
Yeah.
I am a registered nurse. I have a bachelor's degree in nursing. And that's the extent of my education. I have been in public health, as I said, in the health department for 25 years. I've been a nurse for over 40. But many nurses who are interested in public health go on for either a master's in public health nursing, which is available, or they get a master's in public health. So it just kind of depends on the level that they choose to go for. I don't have to have a master's, and I don't.
So do you like do education now? Like now you have the job, do you continually do education?
Go for my own education?
Yeah.
I don't formally go to, say, a college or a graduate school, but we're always going to what they call professional development programs. Okay, there is actually a coalition of public health nurses that have meetings a couple of times a year that we're part of, also part of the flu coalition, that is a statewide coalition that we go to, and we go to a meeting for that once a year, every year for flu, so we do a variety of things.
Was this your guys' expected job when you left high school?
Actually, that's a really good question for me. I'll let you answer it in a second.
Sure.
But when I was in high school, I decided I wanted to be a nurse. And when I went through school, at the time, it was quite a while ago, nurses didn't necessarily need or want to get a degree in nursing. Usually they went to what they called a 3-year program, and they got they had to sit for their tests so that they became registered nurses after their training. But I chose to go to college, and I got my degree. When I was in school, they did do public health. They did what they call a public health rotation, and I actually didn't like it. So I kind of surprised myself when I got into public health. And I didn't actually get into public health through local health department. I was a visiting nurse for a long time, and at that time, the visiting nurses did do public health. We had child clinics. We did follow up with contagious diseases. We went out to help with vaccinations. So now it's a little bit different for the visiting nurse agencies.
So yeah, this wasn't my intended career path. I used to manage nursing home kitchens, and in the interaction with the public health department, they would come into the kitchen every 3 months. I started a dialogue with the inspector, and then went for the training course, got my certifications, and then went back and got my master's in public health. So It's a career you could set out to do from the beginning, or it's a career that you could make a transition into if it's something you'd like to do later on.
So if you're doing something in public health, do you further your education in like toward like a doctoral degree or?
Sure. Yeah, I mean, to be an inspector, you just need your bachelor's, and then you would get additional certifications, and we'll talk about in a little bit. The different things we do about food inspections, lead inspections, and things like that. You can get those individual certifications, and then if you want to further your education to master's or doctorate as well, there's quite a lot of opportunity with that.
Okay.
We actually have students in the office, either undergraduate or graduate students that work with us as part of internships or rotations in their degree. And occasionally we have a physician, a medical student who wants to get an MPH. So right in the middle of their medical school, they take a year off and they get their MPH. So we do have some physicians who choose to do that. Okay. I'm going to quickly go over the public health emergency preparedness. I mentioned before that we do respond if we need to in things like natural disasters. We're fortunate, and I'm going to touch wood somewhere, that we don't have a lot of natural disasters. We have had hurricanes here that have not been that severe, that they've blown our houses down. We don't usually have a lot of floods in this area, but if you remember a couple of years ago, we had a surprise storm early in the year, and power was lost for about a week. Okay, at that time, we opened a shelter for people who did not have power so that they could come and stay warm and be fed and that kind of thing. And it was my responsibility as the community health nurse to run the functional needs part of that shelter, so that anybody who had some disabilities, had some illnesses, needed equipment to sort of help them breathe or whatever, we ran that part of the shelter. So that was 24/7 for at least 7 days we were working. So it was actually the first time I had done something like that, but since then it has helped us develop our plan and perfect it a little bit. But we do have a public health coordinator whose job is to develop plans for us to respond in these kinds of instances and to keep those plans current. So, and when the environmental health section, if we open a shelter, then they have to go in and make sure that the kitchen that's preparing the food is safe. They have to look at restaurants that have closed down because of the storm, make sure that they discard food that is no longer safe to eat, and Jeff will go over it a little bit.
Yeah, you want to make sure that the situation you're taking somebody out of, you're not putting them into a situation that's worse. So you want to make sure the environmental things are taken care of, like Barbara said, food, water, sanitation, because if you're going to put them in a situation that's worse, where they're coming from, maybe in their home with no power, you want to make sure it's an easy transition for somebody.
And then we talk about a man-made disaster, like if there was something like an anthrax. A couple of years ago, somebody got anthrax letters that were sent around. The Public Health Department in that section of the state responded to that to make sure that anybody who had a possible exposure was what they call prophylaxed again. They were given medication to prevent them from getting anthrax. Unfortunately, there was one person that died as a result of that. Apparently she was exposed, I think randomly exposed, so, yes.
What is anthrax?
It's a kind of a bacterial type illness that can come from animals, but it also can be created or developed by somebody in the lab. That they can take the spores and they can make them in a powder form so that they go out. It's a spore type illness, so it's a little bit difficult to treat.
Spores isn't like mushrooms.
I'm sorry?
Spores being, it could be airborne.
Oh,
Yeah,
well.
so you
Yeah.
can easily
So you
breathe
know
it
all
into
about
your
it.
lungs.
Okay. So if we have to do a mass vaccination clinic, I don't know if you remember a couple of years ago, there was H1N1. That was a unique flu that came out that we were concerned would cause a pandemic. So they developed a vaccine fairly quickly, and we tried to get that out to the community. We were in charge of running those vaccine clinics for actually an area. Manchester is considered MDA 33. We are combined in the state with other health departments, so it's Manchester and Glastonbury health departments. So we worked together in an episode like that, and we provided the vaccines to both Manchester and Glastonbury. If it was an illness that required dispensation of pills, which is what anthrax is. We have a plan for that, and that requires that we get a facility, we run people through, we have a whole plan to manage all of that, and we will be in charge of getting that set up and run.
What are symptoms of like anthrax? Is it poisoning?
Sometimes it can be that you have what they call local symptom, so that you get a bad sore. Usually that's a little bit, it's long treatment, but it's a little bit easier. But the dangerous one is inhalation, where you inhale the anthrax or the spore, and then you go into respiratory failure. Environmental health, managing our inventory, and then we do some volunteer recruitment, because to get between the two towns, 90,000 people through a clinic, you need a lot of people to help you with that. So we look for volunteers to help us with that.
Can I ask you a question? Can I ask you a question about the reserve unit? Do they have to be a professional? I mean, is there any space that students could help assist with a voluntary kind of thing if we wanted to do service? I mean, if they helped even move tables around or set up posters or something. I'm just wondering, as I see that, I'm thinking, this class would be awesome. Do you ever use students to help with that capacity?
Okay, we do take volunteers. For the most part, though, we take 18 and over.
Okay.
Just because of making sure that they're safe and
Yeah.
you know, that kind of thing. We do have a medical reserve corps, as I mentioned. You don't have to be a medical person to be part of that, because we use them for administrative duties also. So really anybody can volunteer for that. Some of the people in there are nurses or doctors, but they don't have to be. Certainly, if it came as a group and they were organized under one person, then we could certainly consider that possibility. If we could, you know, sort of train people what to do, like manage a line or, you know, whatever, and just tell people where to go in a particular instance.
Thank you, sorry, that was totally on a side note, but this class, I would love, they can totally, yeah.
All right, so we'll talk about environmental health. Barbara talked about the community health, and we'll talk about the environmental. Like I mentioned, we inspect anywhere in the town of Manchester where food is served. All your restaurants, schools, churches, convenience stores. We inspect them on a regular basis to check for hand washing, temperatures, cleanliness, among other things. If you've ever gone into a restaurant and you've said, you know, this place may not be as clean as possible, please call us, and we follow up on all those issues as well. One cool thing about it is all our inspections are public record, so you can come into our office and request a copy of an inspection of your favorite restaurant. Has anybody been to the new Dave & Buster's? Yeah. We inspected that from the ground up, and as well as the new Maggie McFly's, we were involved with that, so. Yeah. We inspect septic systems and wells. Anybody have a septic system or a well? Oh, okay. Most of the town of Manchester is public water and public sewer, but if you live on the outskirts, maybe towards Glastonbury or towards Vernon, you may have a septic system. So when you turn on the faucet in your home, it comes right from the treatment plant. With a septic system, it comes right up from the ground. Same thing when the water is disposed of, it goes into the ground. In your homes, you know, you flush the toilet and it goes back to the treatment center. So we get involved with evaluating soils. The construction people will bring out a big backhoe, dig a hole typically 6 to 8 feet deep, and we go into the ground and we kind of document what type of soil types there are. So that is one really cool feature of being outside, especially in the summer. When they're building a lot of houses, we go out and we walk through the woods and kind of identify.
What if you have to do this in winter?
Winter, we very rarely do this type of soil testing. Right now, it's going to start picking up spring, right up to the fall. Actually, a week before Christmas, I was out doing soil testing at a property because there was no snow on the ground yet.
Why would you do a soil testing?
We need to find out if the soil is capable of receiving water. We're looking for a couple of things. Groundwater itself or ledge. You want to make sure that the water is able to go right into the soil and kind of cleanse itself before it eventually will become drinking water someday. And you want to make sure it's properly purified. Daycares, when you go to a daycare, have a sibling that went to a daycare, we inspect, we inspect all daycares to make sure that they're safe. Any tripping hazards, we check their records, we inspect their food service operations, things like that. So, public pools, it's going to start getting warmer soon. We inspect all town pools, we inspect all condo and apartment pools.
So is it true that Wolf Hollow is cleaner than all the other pools?
Yeah, I mean, we inspect Globe Hollow regularly, we check the water quality, we also make sure they have the proper safety equipment. Yeah, I mean, we inspect it, so I can't speak to if it's cleaner or than others, but yeah, I mean, it's, if it weren't, we would be able to shut it down until the water quality improved. So, like I said, if you go stay at a hotel, we inspect those, apartment complexes, condos, things like that. We do not inspect residential pools at all.
So is it okay for a pool to have like bugs and stuff?
Is it okay for a pool to have bugs?
Yeah.
Well, I mean, if the pool's properly chlorinated, you won't have bugs, but what we experience now, especially through the winter, is people put covers on it. The covers collapse, and then you get standing water, which can attract mosquitoes. So that can be a real problem.
When I was younger, I used to go to Run Play Summer Camp, and I always saw that there were these small little brown water bugs, and I always wanted to say, oh, the pool was clean and all that, but there's these little water bugs coming in and out.
Yeah, I mean, like I said, in pools with standing water, we see the larvae of the mosquitoes. So we tell people to eliminate any standing water whatsoever on the properties. So. Getting towards vacation season, in other towns I've worked in, we've inspected hotels and motels. Here in Manchester, we inspect them on a complaint basis. If somebody will call up and say, I stayed in a certain room, or the motel may not be as clean as possible, we'll go out and follow up. So, in other towns that I've worked in, we've inspected individual rooms on a regular basis. So, hair and nail salons. Their haircut, get their nails done, things like that. We are working on a program to start inspecting hair and nail salons. Right now we inspect them on a complaint basis. If you go into a hair and nail salon, you ever walk into one and you get a really strong odor of like chemicals? They're supposed to be properly ventilating those chemicals. And we can follow up with them to make sure. Anybody see that new procedure? I don't know if they're doing it too much around here, but they put the little fish in the bucket, and they're supposed to eat the dead skin.
Oh yeah, I saw that on
Yeah.
a TV show before.
The Kardashians, right?
Oh, it was yeah, it's Victoria's.
So,
And it eats all your, it makes your foot
yeah,
soft.
I haven't seen it too much in Connecticut, but that's something we have to pay attention to, any newer technologies or procedures to make sure, because as Barbara talked about, infectious diseases can be.
So if they were to do like the fish procedure, would they be able to would you guys be able to shut down the nail salon, because would it be like illegal for them to do that?
At this point, we do not license or regularly inspect, but if we were called and a customer had a complaint about it, we'd have to work with the state health department to see what procedures were allowed and weren't allowed. We do intend to have like a pretty aggressive inspection program because people do use these facilities quite a bit.
So what does like your typical work week look like?
I arrive to work at 8 o'clock, and it could be a completely different day than the day before. I could be out at a fire, like if there's a fire at a restaurant, we respond to those. I could be at a lead inspection, as we'll talk about in a little bit. I could be out on a septic system. That's the really neat thing about the job, is that you never know what to expect. You could have a plan for your day, and then Barbara could call me and say, you know, we have a possible foodborne outbreak, or we need to respond to a lead case. So there's really not a typical day, but everything we've kind of talked about is kind of what we do. I mean, it just depends on the day. So.
What do you like best about your job?
I like the public interaction. I really like talking with people. You meet a lot of great people, interesting people. And I do like that at the end of the day, if I do my job right and with Barbara, we do make a difference. And that's kind of a rewarding thing to feel at the end of the day, that you've made a difference in protecting public health. Lead paint, as we talked about earlier, Barbara talked about, we do preventative for lead paint. All children, 1 to 3, have to be screened.
Under 6.
Under.
All children under the age of 6 has to have at least 2 lead tests done, especially if they live in an older home. You're supposed to screen for that and make sure that they're tested.
I have a small Cape Cod, and I think it was made in about 1940s. So I don't know. I think my mother has painted it before, but what if say you lick the wall and she hasn't repainted it?
Don't lick the wall.
Yeah, don't lick the wall. We
No, that's why I was like little. So
yeah,
like really
with
small.
the age of the home is they typically focus on pre-1978 for lead paint. But we do go in newer homes. We've been in homes that were built in the 90s or even in 2000s. So if you see any chipping paint in an older home, you want to make sure you're cleaning properly for the lead dust. It's a concern for the small, like Barbara said, 6 and under. So.
And the reason that we look at age 6 and under is that if you have high lead levels as a young child, it can affect your neurological, it can affect your brain. So that we want to prevent people, young children from getting poisoned.
Like Barbara said, rabies is a real concern. Rabies, you may think of maybe raccoons or dogs, but they can affect many animals, including cats and cows and skunks and things like that. So if you do see maybe a raccoon out during the day, or you get bit by a dog, you can definitely see your physician for the rabies. Yeah.
So like, you know how you get rabies and like there's no nose here, so what do you do?
When we talk about prophylaxis, like I did before, what rabies really requires is that if you have what's called significant exposure, then what you should do is go for the prophylaxis treatment, which is a series of shots that you get. You don't have the disease, you don't have the virus yet, but you want to prevent getting it. So they do a prophylactic. If you don't do that and you start to develop rabies symptoms, most times rabies is fatal. So if there's a significant exposure from the saliva of an animal and you're not sure whether they're rabid or not, then usually people call us and talk to us about it and see if it's significant enough for them to go for treatment.
Because I know a guy who he was walking in Hercules and he was attacked by a dog, and then he's okay now. So.
Okay, if he might have been able to check on that dog to see if the dog had its rabies vaccine, and then they don't have to worry so much. I'll give you an example here in town. We had a gentleman call us and say he was out and went to his mailbox and he was attacked by a raccoon. That's sort of not normal behavior. Most animals don't attack. They kind of scamper away from you, so it was suspicious. Luckily, we were able to get the raccoon. The animal control officer was able to get the raccoon, was tested, and it was rabid. So the gentleman went prophylactically to be treated, and he's fine.
How do you track a raccoon who's in
A lot of times, if they get the call right away, the animal is kind of stumbling around.